my name's Lauren Richardson, and I'm a counselor here at Mayfield Counseling Center, specializing in eating disorders. Today, we're going to be talking about what healthy relationships with food look like and what disordered eating and eating disorders may look like in relationship to that. Normalized eating, kind of the textbook definition, would be eating in response to hunger fullness cues throughout the day. When you feel hungry, you eat. When you feel full, you stop eating. Eating a variety of foods, not restricting or overeating, depending on what's going on in your life. I think all of us have probably experienced a time in our lives where we didn't practice normalized eating. That could be classified as disordered eating, where it's slightly outside of that spectrum of normal eating, but not quite all the way to an eating disorder. Today, we're going to start by kind of piecing apart what that might look like. So for disordered eating, it may show up as overeating one night in order to cope with a stressful day at work or difficult emotions. It might be missing lunch because you had a super busy day and just forgot. It might be habitually skipping breakfast, maybe hitting up Starbucks for a latte on your way to work because you're running late. It can show up in a lot of different ways, but that doesn't necessarily mean that there's an eating disorder present. It's important for us to talk about this because although occasionally skipping a meal or overeating might not totally derail our mental and physical health, our body does have fundamental needs that need to be met. And as we engage in some of those behaviors, we might start to move from kind of normalized eating on one end of the spectrum over to kind of eating disorder territory. So what is kind of the distinction between normalized eating, eating disorder, disordered eating, maybe somewhere in the middle here? I think there are three primary indicators that someone may have or be on their way to having a full-fledged eating disorder. Those would be behaviors, obsessions, and functionality. There are really three primary factors that indicate that someone may have or may be on their way to having a full-fledged eating disorder. Those three factors are behaviors, obsession, and functionality. First, we'll just talk about behaviors. So in an eating disorder, there are often multiple behaviors present. So someone may engage in restriction and overexercise, or binging and purging, or laxative use. There can be a whole kind of smorgasbord of behaviors. Also, another thing that's really common in eating disorders is something we call symptom swapping. And so maybe restriction might not be at the forefront of the eating disorder at that time, but another behavior might pop up. So they might be engaging in purging or overexercise in order to compensate for the restriction that isn't happening at that time. Also, those with eating disorders tend to spend a significant amount of time each day on behaviors, or they might engage in behaviors multiple times a day. One thing to note with this is those with eating disorders often, almost always, engage in behaviors secretly. Sometimes I'll hear patients tell me that they will kind of hop around with different people or different groups of people throughout the day so that one person isn't seeing the full scope of behaviors across a 24-hour period. Another factor, like I mentioned before, is obsessions. We often tend to talk about behaviors, focus on behaviors when we're talking about eating disorders, but there is also a mental component to it as well. And it's really an enormous unseen burden on those with eating disorders. They can become obsessed with food, their bodies, their performance. That can be performance related to the eating disorder, and those behaviors can also be performance in work, school, relationships, kind of this perfectionistic tendency that can show up in a lot of different ways. Also, a significant portion of the person's mental energy is spent on the behaviors, spent on thoughts about food and their bodies, which leads us to the final indicator, which is functionality. As clinicians, we're often looking for the impact that a disorder has on someone's ability to function socially, occupationally, in different areas of their lives. For eating disorders, this could show up as a person not wanting to eat out with their friends because they're afraid of judgment. It could be isolation from their loved ones because of just kind of that limited capacity due to the mental load that I mentioned earlier. Um, Difficulty regulating emotions, work or academic performance might also decline as well.